I've never really had health insurance. I grew up in a poor family, and we just didn't go to the doctor unless it was absolutely necessary.
A significant challenge for a lot of Mississippians is the lack of access to affordable health care coverage. So we have a lot of uninsured.
We give all of our new cancer patients a distress screening that rates their stress on a scale of 1 to 10. Typically, the higher distress screenings tend to come from patients that have no health insurance at all.
No more sickness, no more sadness.
My name is Tim Floyd. I'm from Guntown, Mississippi. I used to drive a truck and do some construction, but illnesses have kept me from doing that, and now I play music. In 2012, I was working construction and got off work one day, took my boot off, and realized I had a hole in my foot. It got infected, and I went to the doctor and I found out that I had diabetes and neuropathy. Without health insurance, I just didn't feel like I had very many options or anything I could really do about it.
My name is Thompson, and I'm a radiation oncology social worker at North Mississippi Medical Center. I meet with all new patients at radiation oncology, and I assess for financial needs, emotional needs, anything that our patients might need help with. Not having insurance is something that worries them more than the diagnosis itself in terms of how they're going to be able to afford their health care.
I'm Shane Spees, President and CEO of North Mississippi Health Services. There's a larger number of poor and uncompensated care individuals living in rural America. And our service area is completely rural, which means we treat a lot of uncompensated care patients. And if you were to put dollar amounts to that, we'll provide some $80 million in uncompensated care each year.
After 5 years, the infection had gotten so bad in my foot that the doctor said that we had to have my surgery and take my leg off below the knee. If I'd had health insurance, then I would have been able to go to the doctor when I knew that I couldn't exactly feel my fingertips right, or I knew that I felt weird a couple of days. I could have gone to the doctor, and I don't believe I would have lost my leg.
In rural markets, hospitals are typically the largest employer in that market. So they're the key economic driver in that marketplace. Reducing the uncompensated care and converting it into Medicaid coverage, which would pay the providers for services, that money recirculates in the local economy and has a significant impact.
If Mississippi expands Medicaid, so many more patients could get the care that they need. Then they could focus on getting better instead of worrying about how to pay for medical bills.
Expanding Medicaid in Mississippi would be a game changer.
People ask me if it makes me angry, the stuff that I've been through. It really don't. It doesn't make me angry for me. I get angry for the people that don't get the health care that they deserve, especially when we know expanding Medicaid will help all of us.
When we all see Jesus face to face.